Welcome back to the Tech Zone. Paul, Amadeus Lane, our third and final segment of the show. Now, for some of you out there who have been following me for a number of years, you know that I've always had a struggle with maintaining a healthy lifestyle, losing weight. And someone came into my life a few years ago that they really changed my viewpoint of a lot of things and introduced some great habits that I have not forgotten and still implement today. We're starting to see a shift right now when it comes to digital health, right? Normally when we need to go see a healthcare professional, what do? We get in our car and we go, right? But nowadays we're starting to see health professionals are using technology to reach more people than they could before. Let's face it, sometimes it's hard for ones with physical challenges or even any kind of challenges out there to get to a doctor. But with technology now, the doctor can come to you virtually. Our healthcare provider can come to you virtually. Think about it. When you go to the doctor's office now, sometimes they have a little kiosk there in the waiting rooms. And I was there the other day, and they're playing this content about being healthy, about losing weight, about doing things that can make your life better. And aren't we glad that technology gives us the resources to do that? Technology is changing the game, folks. Embrace it. Get on board. And my next guest is going to join me and talk about what she's doing using technology to help spread the word of living a healthy life. And I'm so happy to have with me one of my great friends who I've known for years. She's been one of those who have tried to help me out with my, let's say, problem of gaining too much sexiness, too much weight. Yes. Talking about my great friend, registered dietitian Ashley Koff here on ABC News KMET. How are you doing, Ashley?
I'm doing awesome. I'm here in Washington, D.C. I'm also live on Instagram. So we'll be talking about technology and health and all that great stuff. And I have to say that from the moment I met you, I always think about, yes, people can be focused on one area of their life, their weight, all of those pieces. But you live life well, sir. And I love that you have such a great attitude and spirit, and you bring that to other people. And so when I look at health, I look at that whole piece, right? Because I've worked with a lot of people that are where they may want to be or where I think they should be weight-wise, that are still missing they're not connected to that joy in life. And I think that you are. So it's great. It's always fun to join you.
Well, Ashley, thank you so much. Like I tell all my friends about you, and I said, she's one of my friends for life because, even though we don't chat as much as we used to, but just the fact that you have come into my life and given me life lessons to help me out to make better decisions is truly, truly priceless. And, one of the things we wanted to talk about during the segment was we know before you would see patients maybe at a hospital, they maybe would come to your office. But how has technology now helped you to help spread the word and helping ones to become a qualitarian or to get their life together?
So technology is really interesting, right? So it helps me show people decisions that I make. So like, for example, right now, I could be having another cup of coffee. I actually love to make, I have an espresso machine. I'm not promoting that brand, but I love to make my own espresso. I don't actually really like the taste of coffee, but I love espresso. And so I make cashew milk or hemp milk, and I foam it up, and I even invite people over for it. Like, I'm obsessed with this whole thing. I always say if the nutrition piece doesn't work out, that's what I'm going to be doing. And what's so fun about it is I can actually show people doing that. But I also can make sure that I can, communicate things like, wow, instead of having a second cup of coffee, why not try the dandelion tea? And if you're feeling like you need an energy boost, you could do something like right now, here I am in my house. I could say, hey, maybe I want to take my multi, and I take a multi that is made with different ingredients from farms. And so I get my B vitamins in that way for energy. And if I want to get my energy from actual food, I can turn around in my cupboard and I can show you what I have in there. Things like chickpeas and hemp seeds and cereals and grains. They're also good sources of B vitamins, et cetera. So one of the things I think of that technology has really enabled that's so wonderful is the opportunity for me to not just tell you what to do, but actually to show it. And on the flip side, what I do with my patients now, which is great, is that I can actually see what's in their kitchen, and we can talk about it. So one of my favorite things to do is to actually go live with a patient, and they open up their refrigerator or they take me through their supplement section and show me what they're doing. And on that part, I can turn around and I come up with ideas that they may have never thought about. Now, I want to comment on one thing. You asked about nutrition in hospitals. One of the reasons I didn't build a career working in a hospital, I trained at County Hospital. I worked at Children's Hospital in Columbus, Ohio when I was still in school. And then I also worked at Cedars in the minimally invasive surgical center. So I have worked in hospitals, but even at Cedars, I was in the outpatient section. It's a really hard structure. So I don't know if any of you have gone to a hospital setting in order to try to get nutrition advice, or if while you were in the hospital, maybe for something like pregnancy and giving birth, or maybe something that wasn't so great, a dietitian comes over to you. We try so hard in the hospital, but it really doesn't give us the time and the space. And also, it's a pretty stressful environment in the hospital, despite all of our efforts. It may not be that you as a patient is able to sit and focus on taking in nutrition information, especially about what are some of the tips that you can be doing in your day-to-day life to make better nutrition happen for you. So I love that technology enables me to connect in real time and also in your home. So you don't even have to, and you'll love this one, Paul, because it was such a burden for me in LA, was you don't even have to get into your car to drive into my office, right? I can literally do the consult with you at home, which is really where you're making, most of your nutrition decisions, right? So, again, I think, and for those watching on Instagram, I think one of the great things you can do, whether you're working with me as a client or whether as a patient or whether working with someone else, is you can do your own video. You don't have to be live with me and send it over. I've had people who will just literally point to all the supplements that they're taking and say, what should I keep? What should I not? But you can also, decide to hire and work with someone like this. And I think I think it's a great opportunity.
And you know what, Ashley, I remember the first time we interacted on Twitter. I remember you asked me how's the lifestyle going. And I said, well, I'm craving something sweet right now. And I remember in a series of tweets in about 15 minutes, you had me to make this awesome like chocolate and peanut butter healthy snack. And I was like, that is so cool. So one of the fun pieces on that is like, when somebody sends me a tweet and they're like, I'm craving something sweet, there's two things that's going on, right? And so I don't know if you're watching on Instagram right now, if you're craving something sweet and you tell me about it. So tell me if you're craving something sweet. If you tell me about it, one of the great things is you're actually reaching out. You're saying, I'm trying to make a better decision. Remember, better nutrition, I can show them to you, Paul. You may have it in my materials also, but there are 9 commandments, or sometimes I call them better habits. Oh, yeah.
The number one right there is that better nutrition better be delicious. So if you're craving chocolate and peanut butter and I tell you to take some carob and mix it with lettuce or, unroasted, unsalted, blah, 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 and you're just like, oh my gosh, this isn't going to taste good, but I'm going to tell you it's good for you, we're never going to get you where you want to be, right? And so, yes, I am the dietitian right now who will tweet you and will say to you, take some chocolate, some good quality chocolate, and go ahead and dip it in, some peanut butter and make that either part of your eating occasion or make it your eating occasion. I also am going to share a treat with you, Paul. One of my favorites that happens to be, this is the great part about having technology and being in my home. So one of my dear friends out in LA started this company. It's also a Dr. Oz favorite. I know how much you love Dr. Oz.
Oh, yeah.
And it matches my outfit. Look at that. So
it sure does.
But this is one of my favorites, and you'll see that nut. So you see the organic on there. It's made with all these nuts and seeds, and it's chocolate. And so the next time you're having a craving, you can take a spoonful of that. For anyone watching on Instagram, one of my favorites to have, just super easy, this chocolate netso. So yeah, Paul, you can I can catch you in that moment, which means that I can help you make a better choice, when we're connected on social media. Now, let me be clear. There are downsides to that. Can we talk a little bit about the negative?
Absolutely. Let's do that.
Yeah, so one of the negative sides is this term that I use it's called infobesity. And I actually think that more people are suffering from infobesity than they are suffering actually from obesity. Because regardless of your health status, too much information is too much. It weighs us down. It overwhelms our body. Just like too much fat, it's going to disrupt normal functioning and really be a challenge to our better health, right? And one of the issues, it's very different than when I started at my practice out, is that we actually today, we have a lot of really good information. People know their stuff. They're like, oh, you can enjoy chocolate if it's better quality chocolate. Oh, you could have dandelion tea. Oh, you could have your multi, right? But just right now, I've given somebody 5 or 6 pieces of information. Well, what if they're scrolling through and getting tweets from other people, right? What if they're, and my solution, oh, by the way, is not to only follow me across any social media, but it's just to understand that between our Facebook, our Instagram, our Pinterest, our TVs, our magazines, our, going to yoga class and having somebody talk about something and, going into the grocery store, going to the gas station and having information while we're pumping our gas. Which was great. There was somebody talking about better nutrition choices, or that's my phrase, but, basically about that notion, even in the gas station. And so I love all that, but it's just too much information. So one of the things that we have to be really careful about, guys and gals, is when we're doing something like this, turn me off if you don't need this information right now, or assess, is the information that I'm providing for you right now going to be very targeted to you? And I actually have an exercise in my road trip program that helps people. It's like a dartboard, and it helps people figure out, first you list out all your sources of information, and then you put them on the dartboard, and you'll see on the bullseye, like how close are you to hitting a bullseye with how targeted the information is that you're taking in most often. If your bullseye looks like you shouldn't even be allowed to play darts with like the cloth ones, then we got to talk about it. But if you're hitting in and closer a little bit, and for example, working with someone like myself, or working with a physician, or working with somebody who really knows your current health status, then that's going to help you. And Paul, we went through that when I first was talking to you, and I said, you know what, before I can talk to you about what you should and shouldn't be doing, I need to know about your life. Like, I might look at you right now and make certain decisions about, like, well, he's got a great smile, and he's like, he's really happy. Gosh, he's probably sleeping a lot. He's like, that great bow tie. But I know nothing about your health history. I don't know, did you go to the bathroom number 1 and number 2 this morning? What's going on from a heart health standpoint? All of these things. So first and foremost, what we have to remember is no matter how beautiful somebody's acai bowl looks on Instagram, or no matter how gorgeous, my celery with hummus that I posted earlier looks, and I said, like, this is a great simple snack, I'm not able to say that to you, Paul Lane. What I'm saying that to is I, Ashley Koff, as a practitioner, have all of these ideas, and some of them may be a good match for you. So one of the things that I do to try to combat that infobesity is that, and I've been working as a practitioner for 20 years, is that I go and don't just do interviews like this, but what I did on my website, and this is another way we can use technology, is I created a membership. And the reason I created a membership is I wanted people to have access to one specific set of information that I think does not exist anywhere else right now. And that information are my Better Nutrition tools, which include evaluations. Because at the end of the day, I could tell you how great magnesium is for you. I could be like, okay, everybody, I want you to have natural calm. It's great magnesium. Magnesium goes inside of our cells, belongs inside of our cells to turn off our fight or flight response. It turns off our stress. It's so important for preventing headaches or addressing them, for, dealing with hormonal issues or post-workout. Like, I could go on and on and on, right? And everybody would be like, sign me up. Like, I want that magnesium now. But the question mark is, do you need that magnesium? Well, it turns out that 70 to 80% of Americans aren't even meeting their baseline recommendation for magnesium. The great part about that is it is also in chocolate. So you can see where my chocolate love and recommendation comes from. However, we need to figure out how much magnesium you need and what are the best sources. And so that's why I created the magnesium evaluation. It's about 10 questions. You go onto my site and you can evaluate that. And I always have a free evaluation on there, so you can check that part out. You don't have to become a member. So right now, everybody here could go on to the tools section, click on and you'll see, or even when you scroll on the first page of my website, you'll scroll down and you'll see that this month we've been giving away the potassium evaluation. Potassium is so important for the health of your body from a hydration standpoint, to make sure that all of the water that your cells need inside of them come in, and that the nutrients with that water comes in. And so we get great skin, hopefully, and our bowels, our digestion, our heart health, like all of that's going to work out really well for you if you are evaluating your potassium. So I hope you saw there are two sides of the coin in terms of how we can work with the challenges of the internet and the tools that we can use, especially for someone like myself as a practitioner, where I can say, I know there's a lot of information out there, and if it's entertainment to you, get that in. But when you actually need help, I want to make sure that you're starting off with assessing where your nutrition is at right now. And that's how you do it with the evaluations.
And you know what? I'm so glad that you touched on the point about over information obesity, or I forget the term that you use.
Obesity, Paul. Yeah. Infobesity.
Infobesity, because I tell you, so many people get bombarded by that. They're on one track of doing something one way, then they try something else, and they have no results because they're just doing this and doing that. And so we need to do one thing and do it well, so to make sure that we could do it. And I'm glad you touched on the supplement part of it. And, because so many people are my friends, because I supplement a lot, and some of my friends are like, oh no, I get everything out of my food, and I'm like, even like mainstream vitamin companies now even say your food does not have the nutrients that you need. So do you think we're finally getting it, Ashley, that we're not getting nutrients in our food?
So two things. First of all, one of the pieces where you said we just need to do one thing better. I actually have a weekly challenge as part of my membership. It's called Do One Thing Better. So this week I'm putting all of my members through taco training because it drives me nuts. Tacos can be part of every better nutrition plan, and there's so many different ways to taco, right? However, a lot of tacos are not better nutrition, right? So I was like, okay, in the name of all this Taco Tuesday and like mania around tacos, we're going to talk about tacos. And so what I wanted people to do this week is do one thing better, which is to make better taco choices more often. And I think that point of just choosing one thing to do better, Paul, is like so spot on, because we can reduce how stressful it can feel to try to keep bringing new things in and do them differently. And an area that is so difficult to understand what is that one thing better that I could be doing is in supplements. So everyone listening and watching, I want you to understand that the one thing better you could do when it comes to supplements is start off with an assessment. So in my membership, I do have an assessment of a supplement evaluation that I've been doing with my patients for 20 years. And so if you want to go that route, that's fine. But here's what everybody can do. You need to think about today. It's not okay to just think about our food, right? Or our beverages as our nutrition. I use the term total nutrition. What total nutrition refers to is what goes in and on your body more often. Do you know that the sunscreen, I'll grab this right now, one of my favorites, because I don't want my skin to age poorly and I also don't want to get skin cancer. So I use this as actually, I don't know if I'm doing this right. Okay, somehow. There we go. Like somehow, yeah. Anyway, it's my beauty powder. It's a stick that I use I had a dermatologist tell me one of the places for women, especially, is on our hands right here and also on our chest. See how I'm wearing all these shirts? Well, if my shirt is not all the way up to here, this whole area is exposed, right? And I'm really good, actually. When I go out, I wear a hat. But one of the reasons I want to talk about that is your sunscreen has nutrients in it, right? So it's doing one purpose, which is to remove a threat and protect you, but it could actually be harming you. What if it has ingredients in there that are going into your body, and I'm using this every single day, that are actually deducting from my better health, right? And so it's so critical when we think about our total nutrition today to think about what goes in and on your body more often. Because remember, what goes on your skin goes into your body without even going through the digestive system.
Absolutely.
Okay, so to your point about supplements, I'm getting there. So in that space, there are reasons for supplements. There are really valuable ones. And one of the things that we want to understand is there is zero benefit to taking a poor quality supplement.
Absolutely.
So know that we all want things to be less expensive, and we've got to work on that piece. And there are ways to get supplements that are less expensive. One of the things that I do is I sign up for Subscribe and Save, and I also started a FullScript account for all of my patients and for anyone who just wants to know what products I approve. And yes, you can shop there. And then when you're shopping there, I've got a discount built in, and FullScript, because they're purchasing things in large quantities, are also offering competitive prices, right? So there are ways for us to be able to do lower costs in the supplement space.
Award-winning nutrition expert, the wonderful Ashley Koff. Ashley, I'm telling you, what you're doing now with use of technology, I believe is going to save a lot of lives out there, and continue to beat that drum as loud as you can, because you will help and inspire a lot of people, Ashley. And it's been an honor chatting with you again. So how can our viewers and listeners find out more information about that? Let's give that information out again.
Yeah, thank you. So for anyone who wants some of my better nutrition tools or just wants to say hi to me, you can do it anywhere on social media. I'm everywhere with some version of Ashley Koff approved, or just Ashley Koff on Twitter. And then my website is ashleykoffApproved.com. And look, I answer the questions that people ask. So otherwise, I'm just going to talk about the things that are of interest to me. So if you have a specific question, why not get it answered, right? And so I encourage you to please share with me, even if it's one somebody said to me today, which I thought was a great question, which is, should I take turmeric from a supplement or use turmeric in my food that's a spice? And so that will be a question that I'm answering for next week. So, they can be really simple questions, but ones that I think are confusing to people. If you have a question, I'm sure somebody else wants to know that answer too.
And the amount of money that Ashley is charging for these services, you can afford it. She's practically giving this away. Put down them Big Macs. Like she caught me in Vegas one time. One of my friends tweeted Ashley eating a Big Mac, and Ashley got on my case. So Ashley will definitely make you accountable, and let's just definitely give her our support.
We get to do it together. Well, Paul, it is my pleasure. And thank you so much for covering this, because it's individuals like yourself saying, like, hey, I'm talking about technology, but I'm going to choose to talk about technology and health also. It's so valuable for those of us that are doing this to be able to share this message with others. So thank you.
It's my honor and privilege. And we'll have Ashley back on again later on in the year and see how things are going. Thanks, Ashley.
Great. Bye, everyone.
All right. A huge shout out to my good friend, Ashley Koff. Ashley, I'm telling you, she knows her stuff. If you follow her plans, it will work out. Now, if you don't, you have yourself to blame. And I love what she said about doing all these different programs. Try this, try that, try that. And you never really get success when you do that. So do something, do it well, and stick to it. And connect with Ashley. She has some great advice. All right. Well, folks, that is the end of the show. I really appreciate you guys staying tuned and being a part of the show. And don't forget, always connect with me, PaulAmadeusLane.com. You can connect with the YouTube channel, the iHeart Radio podcast, the iTunes podcast, whatever you got it. We got you. We got it handled. But great. Thank you for tuning in. Until next time, take care of yourself, folks.